Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Well, hello, and welcome back to the Healthy Living Podcast. I'm your host, Joe Grumbine, and today we have a very special guest. His name is Dr. Ibrahim Jaffe. He's an MD, a licensed medical doctor, and a world-renowned spiritual teacher. He pioneered the field of medical spiritual healing, a deeply integrative approach that addresses the root of physical, emotional, and spiritual illness. He bridges Western medicine with Sufi spiritual wisdom. Dr. Jaffe has helped over 50,000 people worldwide, including celebrities, CEOs, and even those on the brink of death. Heal chronic conditions, awaken their hearts, and transform their lives. And Dr. Jaffe, that's pretty impressive. I am looking forward to our conversation. It seems that we have a lot in common of especially combining the notions of Western medicine and spirituality and herbalism and all of these things to find answers. Welcome to the show.
Oh, I'm happy to be here and glad to talk about these things. It needs to go out for our patients or everybody, so they have the best chance to heal.
I agree. I as we just had a brief conversation, I've been mired in Western medicine recently with all these oncologists and all these different doctors trying to tell me what they think I should do. And it's interesting because I've become my own advocate. I've become my own expert, and I believe that I'm the world's foremost expert on the cancer that I have. And because it's everything's so unique. And as a physician, um, my experience has always been my dad was a surgeon, so I grew up in the medical world. And physicians have this training that they receive, and then they practice what they're trained, and they have influences of pharmaceutical companies and the schools that they are taught by and their funders and all of that, and they seldom stray from their lessons. And every once in a while you'll find somebody who has an integrative approach, and they welcome additional resources and ideas, and it seems that that's where you're coming from.
Yeah, I mean, medicine has changed a lot in the past 20 years. I got my degree in 1983,
Okay.
and so the changes are it's become much more controlled.
Mm-hmm.
So as a doctor, you have to follow certain algorithms.
Right.
And if you don't, you will lose your license or you'll get a malpractice. And
Right.
so
Standard of care.
exactly, you got to do it. And unfortunately, what it's done is brought a lot of fear into doctors. And then it's also created a limitation which allows, the pharmacy groups, the big pharma, to control the use of what we're doing. And so as doctors, we get stuck in that, and it's very hard to get out of it.
No, I understand the sort of the conundrum, and yet I've found doctors are people, and sometimes a doctor will take matters into his own hands and decide that, I'm going to do what's right, as opposed to this thing that they are going to try to make me do.
Exactly. And I think that there's more and more of us around like that. But, we take that risk because you're risking your license and you're risking your practice and your livelihood if you do it. But I think those of us who, appreciate that as a patient, if I was a patient, I want the best chance to live that I can get.
Heck yeah.
And I don't want someone telling me this is all you can do because I know,
Right.
there's a lot of other things that can help.
Well, and really, as a patient, you'll come to realize that with doctors have become so specialized nowadays, where before there was a lot of general practitioners and internal medicine doctors and sort of more broad ranging practices. And nowadays everything is really honed down to these little specifics, and a surgeon's just a surgeon, and the medical oncologist, she just does the chemo, and everybody has their own little thing. But when you start talking to all these different doctors, you'll realize that they don't even agree. And one doctor will read out of his playbook and say, well, you need surgery. And the next doctor will say, well, if you get surgery, you're going to be deformed and you need radiation. And the other doctor will say, well, I think you need chemo, but we want radiation too. And then you go to the integrative guy and he's like, well, there's this whole different approach that we could go after. And then you do your own research and you come up with answers. I think that the specialization has really changed things a lot, and maybe not for the better. I mean, in the better in some ways, because you have people that have gotten very skilled at their craft. You have surgeons that are just amazing, doing work that couldn't have been done with robots and nanoparticles and things. But at the same time, the human body is a miraculous machine on its own, and sometimes all it needs to be is let heal itself, right?
I'm with you 100%, and I agree with you that there's enough discord among specialists that it's very hard to get in medicine. It's hard to get to the truth of what's best.
Right. Well,
So
and I think another thing that I've discovered in Western medicine is that it's very symptomatic. It's not really cure based. I mean, I don't think that doctors are really particularly trying to cure you. They're treating you.
that's
And
right.
once you get into a doctor's care of an illness, generally you just never leave. And you're now in treatment forever, it seems. And
Forever.
I
Yeah.
think that maybe if we get to the root of things, we start finding cures, and maybe the whole goal is to not need a doctor anymore, right?
That's supposedly what we're supposed to be doing, but I agree that medicine today is not curative. It really just prolongs and kind of protects a little bit, but it doesn't ever cure, or very rarely.
And I don't even think they're trying to. I think it's about mitigating quality of life problems, and keeping a thing from getting worse, or removing it. They like to remove things a lot.
Yeah, that's true. But the other side of it is that medicine does bring so much good, especially emergency care, and
Oh, absolutely.
it's done so much good for people, asthma that they have, there's so many things it's treated that people would really suffer. So it's, we're walking that line between incredibly good, but then also not getting to the root of why people are sick.
And that's one of the points I wanted to get into as we start talking about some of your other practices, is that one of the things I've discovered is that everything seems to have a double edge to it. And there's a benefit and there's always a cost to pay, whether it's a side effect or a cost or some issue. And I think just about every element of health has to come with making choices that weigh out, the benefits versus the cost. What's your thoughts on that?
Hi, this is Joe Grumbine, and I wanted to share an update. The platform that hosts this podcast has made some changes to the subscriber settings, and we have a number of subscriber-only episodes that we offer to the supporters, and for a minimum of $3 a month, we can get you signed up. And if you're already signed up and you're having some kind of trouble locating these episodes in the other platforms, I would say maybe the best answer is to unsubscribe and then resubscribe. I'm sorry for the hassle. I don't have any way to make a change, but I'm very grateful for all the support. Thank you.
Well, um, I don't know. I just have a little bit different philosophy, which is um, every system of healing has benefit.
Sure.
And there's actually ways to figure out which system is going to work for somebody. So ideally, like when I'm working with, I don't really think about the cost so much. What I think about is, okay, what are the possibilities with healing something? And then I take it into guidance, and there's different ways of reaching it. and try to say, okay, when I bring it into this place, this happens. When I bring it into a different place, something else happens. So I try to go through the options. For
Okay.
example, say somebody, I had a guy that just had a parotid tumor, kind of similar to what you were dealing with.
Hmm.
And he was looking at, Mexican clinics, German clinics, Austrian clinics, Swiss clinics, all different. But when we really looked at the guidance for it, there was only maybe two clinics that really made a difference.
Okay.
So we were able to cut out all the other clinics, and he ended up going to a German clinic, and he had complete success. It's completely gone.
Nice. Excellent. Excellent. Doing the research, it makes a difference sometimes.
It makes a difference. And so, I think for your listeners, we've got to, first of all, understand that doctors alone are socialized into thinking our way is the best. It's not, but it has value. So we don't want to cut it out. We don't want to throw it away,
Sure.
but we want to make sure that we don't get caught in the quagmire of, our way is allopathic medicine is the best way to go,
Right. Or the only way to go.
or the only way.
So
Exactly.
I'm very interested in hearing about your Sufi practices, and I don't know much about that. I'd like to hear about what that is all about.
Okay, well, Sufism is a spiritual path.
Hmm.
It has to do, I don't know if you know about Rumi and, it's
Hmm.
it's the same as basically as what Rumi teaches, but, a
Okay.
little bit different. It's about walking the heart to God. So you're essentially bringing your heart into God realization.
Nice.
Okay. And the whole system is based on surrendering to divine will.
Wow, I've had to learn that one recently
I bet you have
in
with
a
the kids.
profound way. Yeah.
Yeah. Well, in Sufism, what we have practices that directly put you into divine light, divine love, divine will. And once you get there, you open up to the guidance that comes, and then you do the work that has to happen. So let's say you have somebody with, breast cancer is a common one.
Hmm.
If you went into the guidance with God, you'd see that most breast cancer is about betrayal of love.
Okay.
In other words, that something in the woman who has breast cancer, she's either felt betrayed, possibly she's betrayed somebody, but there's a nature where love got betrayed, and that manifests in the breast.
Interesting.
Isn't that fascinating? And so
Not
to
surprising though, necessarily.
no, because we're, as a culture, we've forgotten about love. We're
Exactly.
not, we don't love anymore.
Right.
And of course for women, you're not really valued when you're deeply loving. A lot of days you're valued for how you look, or you're valued for being a man, or how productive you are, but
Sure.
you're not getting valued for your core, which is your nature of compassion and love, which is
Absolutely.
what women are all about.
No, I totally agree. And that makes a lot of sense. So you become aware of the cause of the problem now.
Exactly. You've got to get to the root, which the root problems are either in the soul, you have to get to the soul,
Hmm.
or they're in the heart. And sometimes they're in the emotions, sometimes they're in the psychology. So there's different places you have to go to find what's the root. Where does it live? And every disease, is connected to a chakra, it's connected to an energy center.
Hmm.
So there's clues, if you get lung cancer, or you get something in your lung, it's connected to your throat center. And so it has to do with expression or creation or some type of, cancer is always about a way that the natural movement of the soul gets subjected to a false reality and gets turned away.
Right. No, like I said, I've recently come very aware of what cancer is and isn't, and turned out it wasn't much of what I thought it was to begin with. And I had my ideas about things, and then you come to experience it and really seek to solve it, and you're like, whoa, there's a lot going on here that I did not expect. And
Uh,
like you said, it's a lot of internal work, just as much as the what I always what I discovered was that it's a spiritual healing But you got to do the work in the physical realm as well.
It's got to be both. You're exactly right. You've got to address it like you did, maybe allopathically, conventional medicine. Maybe you do, integrative medicine in some way, which it sounds like you did. You did the herb.
Absolutely. Yeah, we used a little bit of everything. Yep.
That's the best way to go about it every time. But at the core of it, if you don't get to the spiritual roots, it would come back.
100%, 100%. And I'm kind of curious. I like to hear the stories of, we've had some amazing guests that all come from these different places, and we all find ourselves on this path of healing and wellness. And how did you find this Sufism? Is it something that you learned at a young age, or did you discover it later on in life? How did you find your way to this?
Well, it's a long story, but I was always a healer. Even as a 5-year-old, I was finding illnesses, so I've always had it.
Okay.
But when I was in medical school, they had a girl came in. She was 17. She was dying of acute hepatitis, and I had her in the ICU, and she was running. She was unconscious. She was in coma, but she was running. You could see her legs constantly running.
Wow.
So I was like, what is she running from? I couldn't quite figure it out.
Yeah.
So I was watching her the first 10, 15 minutes, just kind of watching her run in the bed. And then I decided to put my stethoscope, to examine her. And I put the stethoscope, and literally something jumped out of her. It was like
Whoa.
I had my eyes closed, but it was like a black lightning bolt. And
Wow.
it went into my hand holding the stethoscope. And then it was like ice cold, and it went up my arm, and I almost passed out. It was so painful.
Wow.
And I realized that, there were like hidden things. Like this wasn't,
Right. There is a spiritual realm.
incredibly powerful. I mean, it
Yeah.
was, so we tried to heal her. This was in Chicago, and we talked to, University of Chicago, Rush, and University of Illinois. We're all trying to figure out how to heal her.
Mm-hmm.
And nobody could figure it out. So, we gave her this back in 1983. We're giving her, large doses of cortisone and, whatever antivirals we had at the time, which were almost
Mm-hmm.
nothing. And she was dying. So around that time, all of a sudden, the head of medicine was contacted by the Jewish community in Chicago. And they said that that this girl was part of a Jewish school, that they had like 5 deaths of weird diseases in the school that year, and they never had
Wow.
anything happen. And they were concerned, like what was going on. So they called to Jerusalem. They spoke to the head Sephardic rabbi. He went into the Talmud, and they found this ancient remedy, 3,000 years old, for healing
Wow.
hepatitis. So the next day, the chief of medicine allowed it to happen. In comes about 20 Orthodox rabbis, and they're carrying a box, and in the box there were about 30 or 40 doves.
Really?
Yeah, and they brought it into the ICU, which was a big deal, and the other doctors were going crazy because they didn't know anybody that gets sick from the animals, the birds. But anyways, they brought it in. They did some work with the dove. They cleared some feathers, and then they placed it on the belly button of the girl with the hepatitis. And exactly what happened to me, that black lightning bolt shot out into
Wow.
the dove. The dove screamed and fell over dead.
Wow.
So they went through 18 doves, each one taking longer and longer and longer to die as it pulled out this blackness from the girl. And in the meantime, the nurse was adjusting the levophed. Levophed is a pressor agent and pushes the blood pressure up.
Okay.
So when she came in, when they started, they had 50 over 0, meaning they couldn't find the diastolic. And,
Wow.
and it should be 120 over 80. She was 50 over 0.
Right.
So she was barely perfusing her body. She was close to death.
Wow.
And that was on full dose Levophed. By the time 18 Doves later, they had discontinued all the Levophed, all the vital signs had come back to normal.
Wow.
All the blackness was outside of her body, and she was recovering. She actually started to recover. She was coming out of it. And unfortunately, at that time, there was a mutiny in the hospital, and all the doctors got in the cafeteria, and they got together and they said, "We have to stop this. This is, bad. It's against traditional medicine. People are going to get psittacosis from the doves." And they came up. I mean, they didn't have shotguns, but they should have. And and they came up like a lynch party, and they threw the Orthodox rabbis out,
Wow.
and they just nailed the chief of medicine, who was in tears. He was 80 years old, but he was in tears because he was trying to
Wow.
save her.
Yeah.
She ended up dying like a day or so later.
Oh,
So it was a shame, but all of the whatever that evil was, because it really was,
yeah.
it was gone.
Wow. Wow. That's what a story. I mean, that's it and yet I could see what you're describing happening. And it's something that you took me to that place. I could feel it. And you just got to wonder, what if they had not done that? What if they had not, you know,
Yeah.
would she have recovered? And
That was always my question in my own heart. If we had just given her a little more time,
right.
could we
Wow.
have saved
Especially
her?
considering that she had gone from a place of no return almost, and she was already recovering with without the aid of this drug that's propping her blood pressure up.
Exactly.
That's
Exactly.
that's unbelievable. Wow. So we share a lot of that. I believe I've had a similar, not similar in the description of it, but I've dealt with many spiritual experiences that would defy people's logic, and it's you come to realize that everything's happening on that place, and the physical world kind of manifests what's really happening. It's almost a reflection of what's really going on.
It's not. It's not almost. I mean, is the physical world is in my understanding, is a condensation of the spiritual reality. So, what's happening up there is being kind of condensed and precipitated down here.
Right. No, I
So,
totally agree. So you have a practice today, and when somebody comes to you, what is the scope of your practice?
well, I'd founded a university, excuse me, and mostly what I'm doing is teaching people to heal now. So I'm not doing so much practice anymore.
Okay.
But when people come, when I see, maybe 5, 10 people a week,
Okay.
what I do is I review all their medical records. Once I know essentially what the medical issues are, and I like to have, I like a CT scan, I like labs, I like to know what's
Sure.
going on.
Yeah, yeah.
And then I go into the energy body. I look at the etheric body, I look at the energy body, the aura, to see what are the energetic patternings that are going on that are in the energy field that cause the precipitation into the body. Okay, and then once I kind of have that down, then I put myself into the presence of God and in prayer ask the Most High to give me a way through. Like, how do I get through um, whatever is there in the energy field of the body? And usually at that point, there's light that starts to come in as guidance. So I start to follow that light. And usually that's a deeper level of diagnosis. So I'll end up in the person's soul. I'll be looking at the qualities of the soul, such as mercy and compassion and love.
Hmm.
Look at what might be blocking it. Like, let's say it was breast cancer, so I might end up in the soul. I would be looking at the quality of El Wadud, which is a quality of divine love. And then I'll see where the quality has been thwarted or twisted or turned in the soul, blocking it. And then once that's clear where it lives, then we start the process of trying to transmute the memories or the belief systems or the images or experiences that caused the soul to reflect the light of God in the wrong way.
Okay.
Okay, once we can clear it, and then the reflection of the divinity begins to manifest in the soul, usually that is enough in many cases just to get the healing. Once that happens, we start to see the healing.
Nice.
In cancer, it's a little bit more because it's deeper and it's, the cancer is stronger. So you have to,
Right.
you don't just often get it one time. You have to usually take more time. And then once we work it out, we kind of take it down to the heart and or we can go the other way. We can also start from the body and work it up to the divine. But maybe an example would be good. So a woman came in to me. She had congestive heart failure, and she was end stage. Her ejection fraction was about 28%. Normal is 40 to 60. 25 is usually the door of death. They hit 25, they're out. Uh,
Okay.
she was on full drugs, from the allopathic to change it, but it wasn't working. And she came in for a personal retreat with me, which was a 4-day course.
Hmm.
And the first thing I did is I looked at the field, and around her heart, she had just a massive black light that was sitting in her heart.
Wow.
And and then when I went to the soul was can you imagine taking like a piece of bamboo and running a knife over it so it's like broken into layers?
Hmm.
That was what the soul looked like. Like the soul was fractionating like that.
Wow.
So what we started to, I said to her, "Why are you sick?" And she said, "Well, I was in a retreat in New Mexico. Um, I thought it was going to help me. It was a retreat to get me to God. But I was in a little casita, and underneath the casita, there was swamp. It was like a septic tank, and there were swamp gases that came up, and they caused me to have congestive heart failure. I got swamp gas poisoning.
Oh,
Yeah,
that sounds odd, but not pleasant.
not pleasant. So if you're building casitas on your property, do not put any.
No, I know where the septic tank is. We're not going to go anywhere near it.
Good,
Yeah.
good. But when we looked deep, I was like, she's talking about the septic, but that wasn't the black light in her heart. Like when I
Right.
looked, so I said,
Wouldn't
okay, so
imagine.
let's go into that. And we went into it and with the light of God. And what she saw was that she was enraged because this was a religious, I won't say what denomination, but she went into a religious retreat to find God. And the leader of the community molested her.
Oh, jeez.
Okay, so she was dealing with
Deepest betrayal.
yeah, deep betrayal that, and also, she was probably late 50s. So this was kind of her chance to get to know God. And so here she went to this supposed place, and instead of, finding what she wanted, she ran into the molestation and emotionally the anger and the betrayal, and that was the blackness in her heart.
Get it.
Okay, so we were able to get that out. We got that out the first, second day. We removed it. But then we went deeper. We went into the soul. And in the soul, what we found was that she didn't trust God. She felt betrayed by God. And it's her own way she had betrayed God.
Right.
And so the molestation was actually like a precipitation of the own issues of betrayal that were inside of her.
Wow. Wow. And that's difficult. The problem itself is difficult, but realizing what caused it must have been even more difficult.
It was very strong. And when she hit her own anger at God, she didn't know that. She just wanted to come closer to God. She didn't know that she had cut off. When she hit it, she started shaking. She started rocking and yelling, and just the whole body went into like almost like a seizure. But it wasn't. It was energy releasing.
Yeah.
and then it broke through, and the light just cleared, and she connected to God. The light of God came down into her heart, into her soul, and she kind of lit up, and she started glowing. And,
Wow.
like the last day of the event. Well, she went home, and about 2.5 days later. Now remember, her heart was 3 times, or it was 2 times the normal size, or almost 3 times. It was massive
Wow.
from the failure. And 3 weeks later, she calls me and she says, "You can't believe this. My heart has returned to normal size. My ejection fraction is over 40%, and I'm healthy." It all went
Wow.
great.
Wow. That is unbelievable. Well, we're running low on time, but I have so much more I want to talk to you about. And one of the things is my experience working with people that are healers, which is varied. I mean, from Native American to South American to, I mean, all over the world, all different spiritual paths. And we find that it's kind of all the same thing. It's if you're truly on the path, you're on the path, and God is God, and you can come up with whatever name or stories you want to, but it doesn't change what is. And one of the things that I found in common with many healers is a deep empathy and the ability to connect with people in a way that is sometimes even tangible.
Hmm.
But that takes a toll on the healer. And so my question to you is, I'm assuming you have this empathy because of just the way that you're speaking and that you're connecting with people in a very deep way. But how do you take care of yourself? Because you got to shake all this stuff off after you're done.
Well, I think that that's the teaching of healers. Like spiritual healers have to learn how to not take it on.
Hmm.
And every system's different. In the Sufi system, we have practices that actually clean your body. Those are certain types of prayers.
Nice.
And so for me, I pray 5 times a day.
Huh?
And I wash, when I'm done with the prayers, I wash off whatever I've taken from the person.
Nice.
And that really has worked. And the other thing which I like about Sufism a lot is, there's magnetic healing, which is where you're pulling the light off, and there's radiatory where you're transmitting light in.
Hmm.
Sufism tends to be more radiatory. So by radiating it, we're not taking it on so much.
Oh, okay. All right. That makes sense.
And yeah, I mean, for
Well,
me, unfortunately, I'm also a magnetic healer, so I do it. So I have to wash it, but I like the radiatory better.
you've got the tool to do that. I am going to spend some time studying Sufism a little bit, and it seems very, um, Rumi has always resonated the wisdom and the saints, but I never went deeper than that, and I never really, got into. But I've explored and studied many traditions and many practices and have found value in all of them. And I think that this is going to add another level to my understanding. This is something that I've experienced, and most recently, I came to a similar kind of a place in a way where I was losing a battle, and I was doing everything I knew to do, and I was working with a type of prayer ceremony, working with peyote, and it's a very powerful tool. And you're praying all night, and it's a big deal when you're serious about it. And it helped me to find the answers that I needed and to find the clarity that I needed. And in spite of all of that, learning what was going to work, I was still losing. And I came up with an answer that I knew would work, but then I was on a timetable and trying to get insurance to cover this and that and all of these things, and it was chaotic. And the one thing I've learned, and maybe it's just me, but I've had a deep connection with God since I was a young kid. I was raised Catholic, and I had this sort of connection in a way that Catholicism really didn't give me, and it's gone from there. But for whatever reason, God has always given me hard work to do. And then at the very, 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 very last second, he comes in and fixes everything. And this was no exception. And for me, it was like I was literally like my faith was strong. I knew this was going to work. I even saw in one of my experiences, I saw the healing. I was like, I've done this. I'm there already, but I have to do the work on the physical level. So my heart was good. I was like, I know I've got this. I know I'm on the right path. I know I solved this. And meanwhile, this thing's choking me out. It's pushing on my carotid artery. I can't sleep because of the pain. And I'm like, where are you? You know? And then literally at the last second of the last, the minute of the last day, all of a sudden I got lifted up. But what is with the last second thing? Is that just me, or is it happen to a lot of people?
I think it happens to a lot of people because it's about faith. Like
Yeah,
are you going to give up, or
right.
how long does your faith last for?
Yeah, yeah. Well, I guess I found that out a few times. Well, listen, Ibrahim, I am very tickled about this conversation, and I feel like we just barely scratched the surface. I would certainly love to welcome you back anytime you feel up to it. This actually was a last minute notice. I got your assistant reached out to me yesterday, and here we are today. So I find that serendipitous. I think those things don't happen on accident. So um, before we wrap up, how does somebody find you? And if somebody wants to engage with your services, how would they find that?
Yeah. Well, first of all, we just purchased some property up in Santa Barbara.
Oh, nice.
So we're going to have that available shortly if people want to come up and actually visit us, both for the school and the clinic.
Wow. I may have to come up and visit you.
Yeah, you've come up. You'd be welcome. Go to SufiUniversity.org, or you can go to the Institute of Spiritual Healing.com. You can find me at Dr. Jaffe, MD, as well. But those are the places you'd look to find us. And we do have, work for people who are wanting to get to the spiritual side. That's our focus. So if you really want to get to the root, like what's behind your illness, what's the soul base, what's the core issue, what's manifesting, why did it come? That's the work that we're really focusing on for people.
I love it. I love it. Well, I couldn't be more impressed. And again, I would love to continue our conversation. Again, I can't say enough. So, Dr. Jaffe, it's been an absolute pleasure. And this has been another episode of the Healthy Living Podcast. I thank you for all your support, and we will see you next time.
This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right. Well, thank you for supporting this show, and we hope you've enjoyed it.